Tonsil. The palatine tonsil, commonly called as tonsil, is a almond-shaped mass of lymphoid tissue. Situation: it is situated in the tonsillar fossa, which is present in the lateral wall of oropharynx between the palatoglossal arch and palatopharyngeal arch. So this is the oropharynx. There are two folds, that is arches, which extends from the soft palate. One is from the soft palate to the tongue, known as palatoglossal arch, and one from the soft palate to the oropharynx, and it is known as palatopharyngeal arch. Between these two arches there is a fossa, that is known as tonsillar fossa, where the palatine tonsil is situated. So it is situated in the tonsillar fossa in the lateral wall of the oropharynx between palatoglossal and palatopharyngeal arches. External features: the tonsil has two surfaces, medial surface and lateral surface, two borders, anterior and posterior borders, and two poles, upper pole and lower pole. Medial surface: the medial surface is directed towards the oral cavity or oropharynx, and it is characterized by presence of crypt. Lateral surface: the lateral surface is covered by a fibrous tissue which is known as tonsillar hemicapsule. Anterior border: it is related to the palatoglossal arch, and the posterior border is related to the palatopharyngeal arch. The upper pole is related to supratonsillar fossa. The lower pole gives attachment for a ligament, that is fibrous tissue, which is known as suspensory ligament of tonsil. Blood supply: the tonsil is supplied by tonsillar branch of facial artery, ascending pharyngeal artery, branches from lingual and maxillary arteries. Venous drainage: the paratonsillar vein drains the venous blood from the tonsil, which in turn drains into pharyngeal venous plexus. Lymphatic drainage: the lymphatics from the tonsil drains into jugulodigastric nodes, otherwise called as tonsillar lymph node. Nerve supply: glossopharyngeal nerve, that is the ninth cranial nerve. Development: it develops from second pharyngeal pouch. Histology: structure of tonsil or the histology of tonsil. The oral surface, that is the medial surface, is lined by stratified squamous non-keratinized epithelium. Presence of crypts is the characteristic feature of tonsil. Below the stratified squamous non-keratinized epithelium, you can see a number of lymphatic nodules. Deep to the lymphatic nodules, there are presence of mucous glands. Clinical anatomy. Tonsillitis. Inflammation of tonsil is known as tonsillitis. Acute tonsillitis is very common in school-going children. It is rare in infants and elder people. Thank you.